Good morning. It's November 18th, and this is your daily brief in science. Here's everything you need to know. Dogwood Therapeutics has made headlines with promising results from its IMC-2 long COVID study, showing significant reductions in fatigue and sleep disturbances compared to a placebo. This marks a critical advancement, especially considering the lack of FDA-approved treatments for long COVID symptoms. Dr. Lucinda Bateman, the principal investigator of the study, emphasized the importance of these findings in addressing a pressing health concern. The effective treatment regimen in the study involved a low-dose combination of valacyclovir, 750 mg, and celecoxib, 200 mg, taken twice daily. Notably, a higher dose regimen did not demonstrate similar benefits due to increased gastrointestinal side effects. Previous research, including the initial BHC study 201 completed in 2023, also indicated statistically significant benefits of IMC-2 in alleviating various long COVID symptoms. The primary goal of the trial was to assess treatment effects and determine the optimal sample size for future studies, setting the stage for advancing IMC-2 into Phase 2 development. Conducted by the Bateman Horne Center, the results will inform Dogwood's planned Phase 2 study, which aims to enroll approximately 200 participants to further evaluate IMC-2's efficacy. Looking ahead, Dogwood Therapeutics plans to finalize the details of their Phase 2 study and provide further updates in the coming months. Interim data from the ongoing Phase 2 study for Halneuron is expected in the latter half of 2025, while the company is also seeking partnerships for the Phase 3 study of IMC-1 for fibromyalgia. R. Michael Gendro, MD, Chief Medical Officer of Dogwood, highlighted the trial's goal of evaluating the treatment effect size versus placebo as they prepare for the next stages of research. A recent study published in the journal Neurology on November 6, 2024, reveals that motoric cognitive risk syndrome, or MCR, may serve as a significant warning sign for dementia. Conducted by Victoire Leroy at the Albert Einstein College of Medicine, the research identified excessive daytime sleepiness and lack of enthusiasm as core symptoms of MCR. Participants in the study who reported daytime fatigue were found to have a threefold increased risk of developing this syndrome. The study involved 445 participants, averaging 76 years old, all of whom were dementia-free at the start. Data was collected annually from 2011 to 2018 through surveys focusing on sleep and memory issues. The findings emphasize the critical role of sleep in clearing neurotoxins from the brain, linking poor sleep quality to an increased risk of Alzheimer's-related proteins. This connection between sleep disturbances and MCR risk suggests that addressing sleep issues could be crucial in preventing cognitive decline. Early diagnosis of dementia can significantly slow disease progression, often through medical treatment, highlighting the importance of awareness regarding MCR symptoms. In Germany, approximately 1.8 million people currently suffer from dementia, with projections indicating this number could rise to between 2.4 and 2.8 million by 2050 among those over 65. However, the study does have limitations, as it relied on self-reported sleep quality rather than objective measurements, which may introduce biases, especially among those with memory issues. Participants reported their sleep and memory concerns, with an average follow-up of 3 years, underscoring the necessity for accurate assessments in future research. Leroy stresses the importance of understanding the role of sleep in cognitive health, as disruptions in sleep may lead to significant long-term consequences. Individuals experiencing changes in sleep patterns are encouraged to seek medical advice to potentially prevent cognitive decline later in life. Despite these promising findings, the reliance on subjective reports indicates a need for further research with objective measures to validate these results. A recent study from Aarhus University Hospital has unveiled serious risks linked to the use of nonsteroidal anti-inflammatory drugs, or NSAIDs, in patients taking anticoagulant medications. This research, funded by the Novo Nordisk Foundation, analyzed data from 51,794 patients treated with anticoagulants in Denmark between 2012 and 2022, marking it as the largest study of its kind. The findings are concerning. Individuals on anticoagulants double their risk of internal bleeding when using NSAIDs, such as ibuprofen, diclofenac, and naproxen. Specifically, ibuprofen was associated with a 1.79 times increased risk of bleeding, while diclofenac and naproxen posed even greater threats, with risks of 3.3 times and 4.1 times respectively. The study also highlighted significant increases in bleeding risks across various organs. The gut showed a 2.24 times higher risk, the brain at 3.22 times, the lungs at 1.36 times, and the urinary tract at 1.57 times higher. Additionally, there was nearly a threefold increase in the risk of anemia caused by bleeding among those using NSAIDs. Given these risks, the study recommends that patients on anticoagulants avoid NSAIDs whenever possible, and, if necessary, use the lowest effective dose for the shortest duration. The lead author, Mr. Soren Rees Peterson, emphasized the importance of consulting healthcare providers before combining NSAIDs with anticoagulants. In an editorial, Professor Robert F. Story noted the cumulative bleeding risks associated with long-term use of oral anticoagulants and the common use of NSAIDs, advocating for avoidance when feasible. Anticoagulants are often prescribed for conditions such as venous thromboembolism, which impacts about 8.33% of the population, while NSAIDs are widely used for pain relief, accounting for 8% of global prescriptions. The study examined various blood thinners, including rivaroxaban, apixaban, dabigatran, edoxaban, and warfarin, revealing similar risk patterns across these medications. A recent study along the northern Gulf of Mexico has revealed significant insights into tick dispersal among bird populations. Researchers from the University of Southern Mississippi captured nearly 15,000 birds to track the movement of ticks and identify the species involved. Surprisingly, only 421 ticks were collected from the birds, indicating low levels of parasitism despite the identification of 18 different tick species. Notably, 4 species accounted for 81% of the total ticks collected. The research highlighted that short-distance migratory birds carried more ticks compared to their long-distance counterparts. This included some neotropical tick species that had not previously been documented in the United States. Additionally, the study noted the expansion of the Asian longhorn tick, first detected in New Jersey in 2017, which has now spread to 14 other states, showcasing rapid geographical changes in tick distribution. Ticks are known disease vectors and can travel thousands of miles with migratory birds, enhancing their spread. Climate change is further complicating the situation, as rising global temperatures create favorable conditions for invasive tick species in new regions. In the United States, over 95% of vector-borne diseases are linked to ticks, raising concerns about the potential introduction of new pathogens and the spread of existing ones. Experts like Dr. Shahid Karim warn that tropical tick species could establish themselves in previously inhospitable areas, potentially bringing new diseases. Dr. Lorenza Beati also points out that global warming is enabling exotic ticks to thrive in northern regions. Further research is essential to understand the implications of bird-assisted tick dispersal and whether these birds can serve as reservoirs for tick-borne diseases. Meanwhile, protective measures against tick-borne illnesses include wearing long sleeves, using insect repellent, and checking for ticks after outdoor activities. A new study from the Murdoch Children's Research Institute has revealed promising results for children with achondroplasia, the most common form of dwarfism. Researchers found that the oral tablet infigratinib not only increases height, but also improves limb growth in affected children. This Phase 2 clinical trial involved 72 children aged between 3 and 11 years, with participants from countries including Australia, the UK, the US, Spain, France, and Canada. Funded by Bridge Biopharma Incorporated, the trial's results indicated that treatment with infigratinib led to an average growth increase of 2.5 centimeters per year over a span of 18 months. Importantly, the treatment enhanced overall height and improved the upper to lower body segment ratio without causing serious adverse effects. Participants reported only minor side effects, with no severe adverse reactions observed during the study. Currently, the only approved treatment for achondroplasia in Australia is a daily injection called vosoritide, which was added to the Pharmaceutical Benefits Scheme in 2023. Professor Ravi Savarirayan pointed out the significance of having an oral option like infigratinib, especially for children who cannot tolerate injections, and in regions where oral medications are more practical. Achondroplasia affects approximately 1 in 20,000 babies in Australia and is linked to serious health complications, including spinal cord compression and increased mortality risks in early childhood. MCR1 is known as the largest clinical trial site for vosoritide globally, with previous research confirming its effectiveness in promoting bone growth in younger patients. Following the encouraging results of this Phase 2 trial, the research team has initiated a Phase 3 trial and is planning further studies involving younger children aged 0 to 3 years. The findings from this significant study were published in the New England Journal of Medicine on November 18, 2024. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.